Hi everyone, this is part 6, which will be about skeletal system. We will talk about bones and joints. As you know, the skeleton of the human body is consisting of many bones. They are about 206. They are distributed as follows. The bones that are present at the central axis of the human body called axial skeleton. They are consist of skull bones, middle ear bones, hyoid bone, bones of the vertebral column or vertebrae, together with the thoracic cage and the sternum. The bones that are distributed along the upper and lower limbs called appendicular skeleton, which consists of pectoral girdle, upper limbs, pelvic girdle, and lower limbs, etc. A paper from one of the textbooks of anatomy, another distribution also. It consists of axial skeleton, skull, cranium, face, hyoid bone, auditory ossicles, vertebral column, thorax, which consists of sternum and ribs. Other division is the appendicular skeleton, which consists of pectoral girdle, also called shoulder girdle, that consists of clavicle, scapula, bones of the upper limbs, pelvic or hip girdle, lower limbs, etc. The total of these bones are 206. If you want to be a good radiologist, you must have good or enough knowledge about the bones with their bony landmarks, or bones or their landmarks, as seen in this X-ray. If you want to be a good orthopedician, you must have the same knowledge about bones. Also, if you want to be a good anesthesiologist, you must have also a good knowledge about bones and bony landmarks. For example, if you want to give epidural anesthesia, you must palpate the bony landmarks or bony prominences to know the levels of the vertebral columns and the spinal cord. Skeletal system in adult body is made up of 206 individual bones. These bones are arranged into two major divisions, the axial skeleton and the appendicular skeleton. So you should put in your mind axial skeleton, which is present in the central axis of the human body, versus appendicular skeleton that represent the limbs with the girdles. Another paper from one of anatomy textbooks, axial skeleton and appendicular skeleton. The axial skeleton is part of the skeleton that consists of the bones of the head and trunk and the trunk of a vertebrate. While appendicular skeleton portion of the skeleton of the vertebrae is consisting of the bones that support the appendages or the limbs. This slide represents the skeleton of the human body. The bones with the yellow color represent the axial skeleton, while the bones with the green color represent the appendicular skeleton. The appendicular skeleton and the girdles, the shoulder girdle or the pectoral girdle. The word pectoral came from the word pectus, which means breast, and pelvic girdle. The axial skeleton runs along the body's midline axis and is made up of 80 bones in the following regions: skull, or called the cranium, hyoid bone, auditory ossicles, ribs, sternum, and vertebral column. Only the word hyoid may be unknown for you. This picture represents hyoid bone with a green color. It is very important bone in the forensic medicine, if it is a fracture, we may suspect a murder. It is located or situated above the thyroid, cartilage, or Adam's apple. It is made up of bones in the following region: upper limbs, lower limbs, pelvic girdle, and shoulder girdle. This slide is from one of the anatomy textbooks. The pectoral girdle is called the shoulder girdle. It contains 4 bones. It functions to anchor and support the upper extremities and serves as an important attachment site for a great number of muscles that help to move the arm. The bones of the pectoral girdle are as follows: clavicle and scapula, 2 bones on each side. Few notes about the differences and similarities between the upper limb and lower limb. You see in this figure of a skeleton, this slide of a skeleton, the pectoral or shoulder girdle consists of 2 bones, the clavicle and the scapula. The clavicle is connected by a movable joint to the sternum, while the scapula is connected to the axial skeleton only by muscles, while the pelvic girdle is consisting of 3 fused bones. These 3 fused bones consisting the hip bone or os coccyx. So the pelvis is consisting of right and left hip bone that constitute the pelvis. They are different from that of the shoulder girdle. They are immobile. The girdle is the proximal part of each limb that is closely associated with the trunk. The distal part of the upper limb is free. It is represented by the forearm and hand. Forearm consisting of 2 bones, the radius and ulna, that represent the distal part of the upper limb, which is similar to the distal part of the lower limb, which consisting of also 2 bones, the tibia and fibula. The pectoral girdle, again, the pectoral girdle is consisting of a scapula and clavicle. The upper extremity is consisting of a humerus, radius, ulna, carpal bones, metacarpal bones, and phalanges, as seen in this figure. From the distal to the proximal, the orange square is consisting of distal phalanges. Distal, not digital. Distal phalanges, while the blue square consisting of middle phalanges, the green proximal phalanges, the yellow is the metacarpal bones, and the carpals with the purple color, which are 8 in number. The clavicle is attached to the axial skeleton by a movable joint, as seen in this green area. It is called sternoclavicular joint, while the scapula attached to the axial skeleton by muscles only, which is represented by this muscle with a green color called levator scapulae, and these 2 muscles with a blue color called rhomboid major and rhomboid minor. The pelvic girdle consists of sacrum and os coccyx, hip. Each contains 3. Each hip is consisting of 3 fused bones, which are ilium, ischium, and pubis. The lower extremities consist of single bone called femur or thigh bone, tibia, fibula, patella, tarsal bones, metatarsal bones, and phalanges, as in this figure: ilium, pubis, ischium. These 3 bones fuse to each other to form a single right hip bone or os coccyx, together with the left hip bone, which also consists of 3 fused ilium, pubis, ischium, to form the pelvis. Both of these hip bones, right and left, attached to the sides of the sacrum, which is the last piece of the vertebral column, and attached to each other at the joint called pubic symphysis. Vertebrae. We have 33 to 34 vertebrae form the vertebral column of the human body. The number from the 33 to 34 is variable. This is according to the age of the person. They are named by region. Cervical, we have 7 vertebrae. Thoracic, we have 12 vertebrae. Lumbar, 5 vertebrae. Sacrum, we have 5 fused vertebrae. And coccyx, that form 4 to 5 vertebrae, which is also fused vertebrae and are vestigial. This slide represents the cervical vertebrae, which are 7 in number. This slide represents thoracic vertebrae, which are 12 in number. This slide represents lumbar vertebrae, which are 5. This slide represents the sacrum, which appears as one single bone. It consists of 4 to 5 sacral vertebrae. The vertebrae are separated from each other by intervertebral discs, which are fibrocartilaginous in structure, that give strength to the vertebral column, that allow the spine to flex and extend as well as rotate it, and also play a role in the spread of the body weight along the column. This slide represents the fibrocartilaginous discs between the vertebrae. This slide represents the movement of the vertebral column, flexion, extension, and slight rotation. The sacral and coccygeal vertebrae are fused together without any intervening discs, so they appear as one piece of bone, as in this figure. Ribs. There are 12 ribs that attach to the sides of the sternum anteriorly and articulated posteriorly with the sides of the thoracic vertebrae, as in this figure. We have 3 subdivisions of ribs: true, false, and floating ribs. Pelvis. The pelvis consists of 2 hip bones, right and left, which are articulated posteriorly with the sacrum and anteriorly articulated to each other at the pubic symphysis. The word pelvis means basin because the right and left hips, when they fuse together, form a basin-like structure. This figure represents the pelvis. As I mentioned before, it consists of 3 bones that are fused together: ilium, pubis, and ischium. They are attached, as seen in this figure, they are attached anteriorly to each other at a joint called pubic symphysis. Also another figure: ilium, pubis, ischium, and sacrum with the green color, coccyx with a purple color, and femur with orange color, or called thigh bone. Now about anatomical classification of bones. We have long bones like humerus, short bones like those found in the ankle and wrist called tarsus and carpus, flat bones as the bones of the skull or cranium, irregular bones of the face, sesamoid bones such as patella. Another paper from one of the anatomy textbooks. This classification is according to the shape, or we call it anatomical classification or macroscopical classification. Long bones found in the limbs, short bones in the hands, flat in the skull, irregular in the axial, skeleton, and girdle, and the pneumatic bones such as those bones found in the skull, because they are characterized by the presence of spaces or cavities, so-called, or sinuses, so-called pneumatic. Sesamoid found in certain region. Few notes about sesamoid bones. They are called sesamoid bones because they are like the seeds of the sesame. They are small ovoid modules of bones and are named because of their resemblance to the seeds of sesame. These bones develop in the tendons, which are subjected to the friction during the movement of the joint. As we mentioned in the previous lectures, we have several structures that protect the tendon. One of these structures is the sesamoid bones that in the fetal life started as cartilaginous and then ossified in the later adult life. So they are embedded inside the tendons. They act as a pulleys for muscle contraction. Example for the sesamoid bones, such as that in the patella, which is the largest sesamoid in the human body, and pisiform in the flexor carpi ulnaris of the wrist or carpus, pisiform bone. Another example is that sesamoid bones as seen in this X-ray that are found in this X-ray or near the pecto, as pointed by the red arrow. This also, the red arrow and the red circle represent the patella. This large dark shadow, white shadow, represents the patella, which is the largest sesamoid bone in the human body. Another topic about the skeletal system is the bony landmarks. We have too many bony landmarks. The most important one, as seen, is in this paper of textbook of general anatomy: condyle crest, epicondyle, facet, foramen, fossa, groove, line, malleolus, notch, protuberance, spine, spinous process, trochanter, tubercle, tuberosity. Condyle is a rounded articular area. Rounded articular area. Crest is a ridge of a bone, like iliac crest. Epicondyle, this is situated, epi mean above. It is situated above the condyle. Facet is a smooth, flat area usually covered with cartilage. Fossa mean depressed area. Groove is elongated depression. Notch is an indentation at the edge of bone. Trochanter, large blunt elevation. Tuberosity is a large rounded elevation like ischial tuberosity. Tubercle is a small raised eminence. Another definition is that a crest is a narrow ridge-like projection. Process, it is any marked bony prominence called process. Ramus is a flattened angular part of a bone. Crest, process, ramus. This is the crest that extend from the greater and lesser tubercle of the humerus. This crest also, it is an elongated edge from iliac bone. This is situated at the iliac bone, so it is called iliac crest. This process called mastoid process. Mastoid process with a green color. This is the ramus of the mandible. It is flat and angular. Another bony landmarks is the spine, which is a sharp process like a spine of the scapula. Trochanter, it is massive process founded only in the femur, greater and lesser trochanter of the femur. Tubercle, it is small, situated in the humerus. Tuberosity is a roughened area, such as tibial tuberosity and radial tuberosity. This is the ulnar tuberosity as seen in this figure. Head of the bone, neck of the bone, This is coronoid fossa. As we mentioned before, it is a depression. Epicondyle, medial and lateral. This is the spine of the scapula. It is very famous and familiar spine of the scapula. Also, this figure represents the femur or thigh bone. The area with the green color represents the trochanter. It is called, as it is large, it is called the greater trochanter. This small blue area represents also trochanter. As it is small, so it is called lesser trochanter. This line between the trochanters called intertrochanteric line. Also the head and neck of the femur. This is the greater tubercle. Another bony landmarks are the fissure, which is a narrow slit-like opening, such as that seen in the orbit, called superior orbital fissure. Foramen, which means opening. This fissure is an elongated groove or elongated fissure. As it is present in the orbit, so it is called, as it is present in the orbit superiorly, so it is called superior orbital fissure. Foramina, this slide represents the foramina inside the cranium, so they are called intracranial foramina. It represents the passageway for arteries, nerves, and veins. Another example for intracranial foramina. This foramina pointed with yellow arrow, as it is large, so it is called foramen magnum. Foramen magnum. Other bony landmarks is the fossa, which is a flattened or a shallow depression of the bone. Sulcus, it is a groove that accommodates for a vessel or nerve or tendon. This fossa, this is the most famous fossa in the human body, called at the elbow joint, called olecranon fossa. This is intertubercular groove or bicipital sulcus, sometimes named bicipital sulcus, situated between the greater and lesser tubercles of the proximal end of the humerus. Another bony landmarks is the condyle, which is a large rounded area. Facet is a flattened or shallow articulated surface. Head, it is rounded articulating end of the bone. This is the condyle, rounded area. The most famous one is the medial femoral condyle, as seen in this figure. This is the distal end of the femur near the knee joint. It consists of, with orange color or brown color, the condyles, medial and lateral, or outside and inside condyles. The condyles above the lateral medial condyles, called lateral and medial epicondyles, because they are situated above the condyles. And this depressed area called fossa, and as it is situated between the condyles, so it is called intercondylar fossa. Also, this figure represents the head, neck of the humerus, tubercle, tuberosity, intertubercular groove. This is also very famous. The deltoid tuberosity, very famous in this bone, humerus. This figure represents the facet, which is a flattened articulating area between the vertebrae. This is the end. I hope you enjoyed my presentation.